Hi friends, today I'm here with some of the CBT sample questions related to mental health. I guess these are super helpful for your examination. So the first question is, on a psychiatric unit, the preferred milieu environment is best described as option A, providing an environment that is safe for patient to express feelings. Option B, fostering a sense of well-being and independence in the patient. Option C, providing an environment that will support the patient in his or her therapeutic needs. Option D, fostering a therapeutic social, cultural, and physical environment. Option D is the correct answer. Question number 2. When caring for clients with psychiatric diagnosis, the nurse recalls that the purpose of psychiatric diagnosis or psychiatric labeling to option A. Identify those individuals in need of more specialized care. Option B. Identify those individuals who are at risk of for harming others. Option C. Define the nursing care for individuals with similar diagnoses. Option D. Enable the client's treatment team to plan appropriate and comprehensive care. The correct option D. Enable the client's treatment team to plan appropriate and comprehensive care. Next question. A patient with antisocial personality disorder enters the private meeting room of a nursing unit as a nurse is meeting with different patient. Which of the following statement by the nurse is best? Please leave and I will speak with you when I am done. Option B. I need you to leave us alone. Option C. You may sit with us as long as you're quiet. Option D. I'm sorry, but HIPAA says that you can't wait there. Do you mind leaving? The correct answer is please leave and I will speak with you when I am done. Next question. Which of the following is a guiding principle for the nurse in distinguishing mental disorders from the expected changes associated with aging? Option A. A competent clinician can readily distinguish mental disorders from the expected changes associated with aging. Option B. Older people are believed to be more prone to mental illness than young people. Option C. The clinical presentation of mental illness in older adults differs from that in older age groups. Option D. When physical deterioration becomes a significant feature of an elder's life, the risk of comorbid psychiatric illnesses arise. The correct answer is the clinical presentation of mental illness in older adults differs from that in other age groups. The next question is, the Mental Capacity Act 2005 does not explore which of the following concepts? Option A, Advanced Treatment Decision. Option B, Act's Code of Practice. Option C, Independent Mental Capacity Advocates. Option D, Mental Health Advocates. The correct answer is Mental Health Advocates. Next question. Risk for health issues in a person with mental health issues. Option A, increased than in normal people. Option B, slightly decreased than in normal people. Option C, very low as compared to normal people. Option D, risk is same in people with and without mental illness. The correct answer is increased than in normal people. That is option A, increased than in normal people. Next question. Patient's husband died. The brother of the patient saw that she was upset but mentally and physically unwell. After a few weeks, the patient called her brother and said that her husband died yesterday. She verbalized, I didn't know he was sick. She also told her brother that she has been seeing mice and rats in the house. The patient had difficulty sleeping, had incontinence and pain in urinating. A community nurse visited the patient. She observed that the patient is reclusive, passive, but pleasant. What could be the problem? The correct answer is delirium due to UTI. The correct answer is delirium due to UTI. Next question. What are the principles of communicating with a patient with delirium? Options are use short statements and closed questions in a valid, quiet, familiar environment. Use short statements and open questions in a valid, quiet, familiar environment. Write down all questions for the patient to refer back to. Communicate only through the family using short statements and closed questions. The correct answer is use short statements and close questions in a valid, quiet, familiar environment. Next question, which of the following would be an appropriate strategy in reorienting a confused patient to where her room is? Option A, place picture of her family on the bedside stand. Option B, put her name in a large letters on her forehead. Option C, remind the patient where her room is. Option D, let the other residents know where the patient's room is. The correct answer is remind the patient where her room is. That is option C, remind the patient where her room is. Next question. You are caring for a patient who is known to have dementia. What particular issues should you consider prior to discharge? The correct answer is you involve other support services in his discharge. The hospital discharge team, social services, the mental health team. Next question. How should be the surrounding area of a patient with dementia? Option A, increase stimuli. Option B, creative environment. Option C, restrict activities. The correct answer is, as you can see, option B, creative environment. The last question, what is the difference between denial and collusion? Denial is when a healthcare professional refuses to tell a patient their diagnosis for the protection of the patient, whereas collusion is when healthcare professionals and the patient agree on the information to be told to the relatives and friends. Option B, denial is when a patient refuses treatment and collusion is when a patient agrees to it. Option C, denial is a coping mechanism used by an individual with the intention of protecting themselves from painful or distressing information, whereas collusion is the withholding of information from the patient with the intention of protecting them. The correct answer is denial is a coping mechanism used by an individual with the intention of protecting themselves from painful or distressing information, whereas collusion is the withholding of information from the patient with the intention of protecting them. Hope you guys enjoyed this video, and don't forget to subscribe to my channel if you like this video. Moreover, leave a comment in the comment section below if you find this video beneficial so that I can prepare more videos like this. And don't forget to share these videos with your friends who are preparing for CPT. All the very best for your CPT examination, and see you soon with another video. Bye bye.